Hello everyone. Today's video is about a possible adverse event or adverse effect from having prolozone injections, which is a combination of prolotherapy and ozone solution or ozone gas into knee joints. These knee joints in someone with rheumatoid arthritis and osteoarthritis, and possibly just no effect from the treatment or maybe some kind of a worsening from that. So let's jump into the question here. Just before jumping into that though, I always have to make sure everyone is aware that this is for informational purposes only. I'm not providing any medical advice here, and if you need medical advice, please ask your healthcare provider for that medical advice. And also, if you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I would really appreciate it. So thanks in advance for taking a second to do that. So maybe a week or so ago, I posted a video all about therapy that I use all the time with my patients called Prolozone, combination of prolotherapy injections, which is basically injecting a hypertonic solution, usually dextrose, combined with a anesthetic, combined with ozone. And in the video, I was talking about how it can be really helpful, and I mentioned a few recent cases that did really, really well with just even one treatment of prolozone treatment. So can be really, really helpful and effective. So somebody posted a question on that video, so I'm going to read that out now. So it says, I had prolozone injections in my knees. I have osteoarthritis and rheumatoid arthritis in my knees, and I couldn't see that it helped, so I ended up having to get prednisone injections. And when the rheumatologist checked with the ultrasound, he said this time I didn't have any fluid and that the synovial fluid, I presume you mean here, had thickened. So it's like the fluid inside the joints for folks who don't know. So that synovial fluid had thickened in the knee joints. What does this mean, and did the prolozone cause this to happen? My knees are better after getting the prednisone injections as far as being able to bend and straighten them, but still some pain when bending to sit and stand. I also have Bartonella that may be causing some problems as well. So thank you for the question, and thanks for chiming in on this. I very much don't like to live in an echo chamber, so as much as I happy to I tend to post videos about things that I'm excited about, that I'm seeing helping in practice, but I generally ask folks if they're interested or if they're open to it, posting in the comment section, like, Prolozone helped my patients. It doesn't help everyone, of course, but helped a lot of my patients. What's your experience been with it? And it's great to hear people say, yeah, it helped me too. And then, if someone's like, no, it didn't help me or made things worse or something, I appreciate that feedback. So it's good to hear what people are saying. So I guess I have a few thoughts on this. I mean, and again, I'm just chiming in here, I'm reading this in a YouTube comment. I'm not this person's clinician. I'm just, kind of sharing some thoughts here, just as food for thought. I don't have all the details, of course, but I mean, just the one thing that comes up in my mind is that there's only so much detail and only so much insight that we can get with a knee joint using an ultrasound. Ultrasounds are great. I've done ultrasound guided injections before, ultrasound imaging on joints to see where to guide the needle, and just speaking from experience, like, you can certainly get it's using an ultrasound, we can very effectively see where the needle needs to go to get inside of the joint. But in terms of actually assessing the joint thoroughly, I mean, an ultrasound pales in comparison to an MRI. While it does give some information that an X-ray is not able to give, in terms of getting good insight into joint spacing and more insight into what's happening with the intra-articular space of a joint, there's even a fair bit that an X-ray can tell us that an ultrasound can't. So there's really only so much we can tell with an ultrasound when looking at a joint, just for context. So in terms of getting, and just let's see here, kind of being able to comment on the amount of fluid inside of a joint, like, there's only so much insight you can get with the ultrasound, just for context. In terms of being able to see that synovial fluid had thickened, I mean, with an ultrasound, the denser a structure is, that does change the nature of the ultrasound waves as they're reflecting back at the ultrasound probe. So whatever they're bouncing off of is going to dictate how those waves are picked up by the sensor. And so it may very well be that someone with enough experience could say, oh wow, the synovial fluid kind of looks thicker, based on the ultrasound. But I'm again just not sure to what extent one could get a lot of detail in terms of the thickness of the synovial fluid. So I'm certainly not saying that the doctor's wrong or anything like that. I'm just saying that I'm just not sure to what extent that could be assessed, and like, was it a little bit thicker or slightly thicker. anyways, that's just kind of food for thought, reading through this report here. But kind of getting to the question of like, oh, could prolozone have caused a thickening of synovial fluid, or made things worse in some way, shape, or form? So I'm not aware of any research literature that has shown a worsening from prolotherapy or ozone therapy injections into knee joints. A lot of the studies that have been done on those therapies have been with knee joints. We have quite a lot of evidence around that, and I'm not, aside from being a bit sore after an injection or something like that, there's really no significant side effects that are reported following these injections. So they generally seem to be very, very safe. And I can say in my clinical practice, in my clinical experience, aside from some patients, having some post-treatment soreness, which does happen, usually it's quite mild, fairly short-lived, like clears up within 1 to 3 days. It's generally really, really well tolerated. So I'd be very surprised if prolozone solution, like a prolozone treatment, would cause any kind of a have a negative impact on synovial fluid or whatnot. I feel like if it was something that was going to happen, unless it was just a freak occurrence, like of all the thousands of injections that I've done over the years, I feel like I would have seen that at least once in my own practice, which I have not seen that. So I think it's quite unlikely. Just a couple of other comments here, because yes, there's this thickened synovial fluid that's mentioned and whatnot, but just kind of addressing the fact that there wasn't any improvement from the prolozone. So I guess two thoughts there. The one thing just to be on the lookout for, just for folks listening in general, if like, yeah, I want to try some of that prolozone, it sounds pretty good. Maybe not based on this anecdote here, but from my other video, like, yeah, this is something I might want to check out. There's a sometimes some confusion and some disparity around the language or the nomenclature that's used with describing different injection therapies. So some clinicians, when they say, oh, I use prolozone, they mean just ozone with an anesthetic. No actual prolotherapy in there. And then sometimes they do indeed mean prolotherapy plus ozone. Sometimes when they say prolozone, they actually mean a concoction of things that would include some dextrose, some anesthetic, a little bit of steroid, like a little bit of corticosteroid, maybe some injectable homeopathics, maybe some B vitamins. So there's different there's no one set definition of what exactly is prolozone. That's why when I posted my original video, I believe I said by prolozone I mean prolotherapy, which is dextrose and anesthetic, like a hypertonic dextrose solution plus anesthetic, along with ozone. That's what I mean by prolozone. But when someone says, oh, I had prolozone injections, it can mean different things. Just like when people say I had prolotherapy injections, sometimes that means different things, because there's another therapy called neural prolotherapy, or now it's referred to as perineural injection therapy. But I've had patients who have come in saying like, no, I had prolotherapy like 100%. This is what I had done. And then I asked them, well, like, what did the procedure look like? And then they described to me perineural injection therapy or neural prolotherapy. So they're convinced they had prolotherapy, but it was actually something different. So just that's one other factor to consider, where for a person, if they have, say, osteoarthritis, and the osteoarthritis is fairly progressed, then just ozone and anesthetic might not be all that effective. It could help with symptom management for some folks, for sure, but the prolotherapy part of the solution is really what triggers more of that healing and recuperation of the joint, if it's recoverable. Not every joint is. So that would be just one other factor to consider. And then the final thing here is that with rheumatoid arthritis, like when there's that rheumatoid arthritis variable in the mix, that can change things. With rheumatoid arthritis, I tend to be really, really cautious and quite hesitant, to be perfectly frank, to work with regenerative injection therapies, whether it's prolotherapy or platelet-rich plasma therapy, because of that inflammatory factor. Ozone, I'm generally very comfortable injecting ozone into a rheumatoid arthritis, a joint affected with rheumatoid arthritis, because it has immunomodulating properties, it has anti-inflammatory properties, it has analgesic properties. But when we start adding in the proliferative agent, whether it's platelets from PRP or it's dextrose from prolotherapy, that can cause an inflammatory component as part of the healing cascade, and that could potentially exacerbate say RA, so like rheumatoid arthritis. So there could be a scenario where like maybe this didn't work so well because the prolotherapy solution, assuming that it was in there, because of the aforementioned differences in definition sometimes, but if there was indeed prolotherapy solution in there, it may be that the Prolo kind of was jacking up the inflammation a bit more with the RA, but then the ozone stepped in and actually started to mitigate some of that inflammation, so it kind of led to this net neutral effect. So that would be another possibility. So yeah, with OA and RA combo, it certainly can be a harder thing to treat. And yeah, if a patient walks into my office and they have OA and RA in the same joint, I'm having a different conversation with them as opposed to if it was just RA or just OA. The treatment approach is going to be somewhat different, and also our expectations around treatment are going to be a bit different as well. In those types of cases, I would usually talk to them about maybe just doing ozone injections first, make sure we're getting some systemic therapies in there too, possibly low-dose immunotherapy, talking about dietary modifications, getting some systemic immunomodulators in the mix, trying to really settle things down with the RA as much as possible, and then hopefully we can get that really well settled, and then bring in the proliferative treatments like the Prolo or PRP or whatever it happens to be. So anyways, every case is different, but just my thoughts on this. So thank you for the question, and I am glad to hear that your knees are feeling better. I hope they get all the way better. And if anybody has any questions about prolotherapy, prolozone therapy, perineural injection therapy, any of these topics, or want to share your experience with any of these therapies with the rest of us, that is welcome. And any questions about any other topics, just post in the comment section below, and I will do my best to answer as soon as I can.